Healthcare shouldn't be a luxury, and dental care shouldn't be treated like some optional extra part of the body. If a country taxes its people, then the people deserve to stay healthy without going into debt.
As Canada continues to face a cost of living crisis, even Canadians' teeth are feeling the pain. And dental care professionals say new numbers from Statistics Canada showing some Canadians aren't going to the dentist at all is concerning.
We hear about things like gum disease, cavities, all those things. You have a much better opportunity to prevent them with early detection.
The data shows more than 1/3 of Canadians did not see a dentist for a full 12 months, with nearly the same number reporting they were without dental insurance. One of the biggest factors behind why Canadians had not seen a dentist, the cost, with some avoiding checkups while others get their teeth checked, then avoid a further procedure. Canadian Dental Association President Dr. Heather Carr says proper insurance can make it easier for people to get their teeth checked out. It's why she says Ottawa's dental care plan could be big at helping various groups, such as low-income earners.
A big part of having healthy teeth is preventing the disease, knowing how to take care of your teeth, diet, and all of these are tied into lower income as well.
Ottawa aims to begin coverage by the end of 2023 for people under 18, persons with disabilities, and seniors. It hopes to have up to 9 million uninsured Canadians covered by 2025. Healthcare professionals like Dr. Carr say seeing a dentist is not just about having a great smile, because oral care can help in taking care of your overall health. So the earlier you sit down in that dentist's chair, the better. Sean Preble, Global News.
Right now, millions avoid going to the dentist because it's too expensive. A simple cavity can turn into an infection can turn into an emergency, and an emergency becomes thousands in medical bills.
As recent immigrants, Aboriginal groups, they have the highest level of oral health problems, the highest levels of disease, and they have the greatest difficulty getting to see a dentist or other dental professional to have those problems dealt with.
Your mouth is connected to your whole body. Oral infections are linked to heart disease, diabetes, and even pregnancy complications. Science is crystal clear. There's no such thing as health without dental health. The Journal of American Heart Association showed that gum disease increases heart disease risk by almost 20%.
Why Japan? National health insurance. Studying abroad in Japan is an exciting adventure, but sometimes unforeseen things happen. You could catch a cold or get hurt. And that might worry you. We hope Japan's national health insurance program can put you at ease. Did you know that anyone living in Japan is subscribed to some form of health insurance? If you study in Japan for more than 3 months, you will be joining NHI. NHI is a system where the national government, local governments and individuals share medical expenses. You can join NHI at your local city or ward office and decide how you will pay the regular fee. A few days later, you will receive your NHI card. Don't forget to bring this card with you when visiting the doctor. Then you only have to pay 30% of the medical costs. The other 70% is covered by NHI. Whether you are visiting the doctor for a cold or the dentist for a toothache or going in for surgery, 70% of your medical costs are covered. Prescription drugs too only require a 30% co-payment by you. And it doesn't matter how small or large the hospital is or where you are in Japan. Let's hear from some international students.
I pay $2,300 a month. I don't think it's expensive. It's the same price as a simple haircut.
That's reassuring. Now, when and how was this system developed in Japan? A similar system traces back to the 19th century. In poor rural areas, peasants would each contribute rice regularly to secure access to a doctor for everyone in the village. This system is called jōrei and is considered the prototype of Japanese health insurance. The earliest model of Japan's current health insurance was established in the early 20th century. In 1918, an influenza pandemic spread over the world. As a countermeasure, people in Japan started wearing masks, a custom still practiced today. In the 1920s, countries around the globe established public health insurance systems. Japanese health insurance developed from 1922 onwards, and eventually all Japanese citizens and residents had access to national health care. Healthcare is not just affordable in Japan, the quality is high too. Japan has one of the highest standards of medical care, ranking number 10 on the list of WHO member states. Boasting more than 65 hospitals per 1 million people, Japan has the third highest hospital density among the OECD states. And with 13 beds per 1,000 citizens, Japan also has the highest density of hospital beds out of all WHO member states. And to top it all off, the number of doctor consultations per person per year is the second highest out of all OECD member states. These numbers show how accessible Japanese medical care is. It's reassuring to hear about Japan's NHI and the high standard of medical care. But what is it like to actually go to the doctor in Japan?
It was a very good experience every time. The nurses and the doctors are always very nice. They try to make sure that I feel at ease, that I understand whatever is going on around me or with myself, what health problems I have. They sometimes even check the medical terms on the internet and explain in English.
Why Japan? That's why.
Japan covers medical and dental under universal CAL, fillings, crowns, cleanings, all included, and they use digital systems to keep corruption almost at zero.
I want to start with a simple question. Which country in the world has the best healthcare system?
Yeah, so I hate that question. Here's where you should ask me why I hate that question.
I knew you were going to start with that question.
I think it's a question that a lot of people ask. Which country has the best healthcare system? And
I don't think there's a correct answer to it.
It depends on what it is that we value.
I'll give you an answer, but then I'll tell you why the answer might not be applicable. If you look at the World Health Rankings, the country that came out on top is France. I think in general, starting from France and working northern, you tend to get the best healthcare systems. But the reason why it's not entirely applicable is that what works in one country may not work in another country.
So a number of years ago, just a few years ago, I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament, or like a tennis tournament. And we had me and Aaron, Uwe Reinhardt, Ashish Jha, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings, for which system we liked better. And then we ultimately got a winner. But one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2. And we each had different reasons. You know, someone was very big on the cost, equity, access, or the quality. And so to me, look, this is 5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
On the other hand, I think everyone, especially experts, should be skeptical that they know the answer, because what works in one country or one setting doesn't necessarily work in another.
So, there are aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install, like a new fridge.
So maybe the better question is, what would the best system for the US look like?
And what would that look like?
So a good healthcare system, or let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes. One is,
how does it affect our health as a country?
How long is it that people are living? What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment greater than the cost of the treatment?
A bad healthcare system could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others. So a good system would fix both problems.
And the third dimension for healthcare system is, how well does it reflect our values as a society?
And by values, I mean, what are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us. But that answer profoundly affects how you answer questions about what's good and bad about healthcare.
And I would hope that going forward, as we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
So yeah, that would be the right thing to do in principle. That the next question should be like, can we get there from here? And I just don't see it.
what we've seen over time is that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40, and then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
and they are all living, people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not kept up with the life expectancy increases in other countries.
So the US becomes increasingly an outlier, both in terms of outcomes, that is life expectancy, and in terms of spending.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way. I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists, that the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view that other countries have just figured it out. And what we should be doing in the United States is copying what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with what I would call universal health care.
One is the insurance part, that is who runs the insurance, and you can have socialized insurance where the government is running the insurance, or private insurance where private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
There are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare, and people belong to a single government system.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
And France has yet a different kind of a system, also not government owned. And Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems. The thing that they share in common is that they're universal.
So I think, coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans have become so politically charged and tied to a particular candidate or a particular viewpoint that has become completely partisan and will shut down constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate it by the share of government in the system. You evaluate it by whether patients want the care that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think they are better off in many other countries than here in the US.
But for a lot of diseases, for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
In Denmark and Norway, the least corrupt countries on earth, healthcare is universal and dental is fully free for children, seniors, and people who need extra protection. This proves a simple truth. If a government wants to protect people, it can. So what does a compassionate healthcare system look like? It looks like this. 1. Everyone gets medical plus dental coverage. 2. Preventative care is free because prevention is cheaper than emergency care. No surprise bills. AI flags corruptions instantly, keeping the system honest. And people pay taxes and actually see the results. AI can help governments monitor wait times, prevent fraud, predict disease outbreaks, ensure every citizen gets care faster. Healthcare becomes smarter, cheaper, and fairer. We can build a world where no one fears getting sick, where dental care isn't a luxury, where governments treat health as a right, not a business. So this is my last video for Humanity Blueprint. I hope you guys liked it. So the gist of it all, I just think with AI, there's like this opportunity to like learn from it, to see like how do we better ourselves as society, as humanity, like close the bridge of miscommunication. This video is long, but it is healthcare. It's complex, but I do really think if you made it this far, like to really pay attention to it. It is a complex issue, but I do think it's something that can be done. So if you ended up watching till the end, please don't forget to like and subscribe. And so yeah, pretty much the Humanity Blueprint is done. But now I feel like I am going to just do vlogging and just like things to do around my house and, you know, and make my life even better than it is. Peace on the streets, as somebody once said. See if you know the reference.